my name is Maria Uribe. I'm in my school scrubs. Here is my student ID. I'm going to be doing the healthy prenatal education video. There's a lot of information to go over for pregnant women. The initial appointment is your first month appointment. They start at 4 weeks and they go until 28 weeks. And your second to last appointment, they go from 28 weeks to 36 weeks. Your weekly appointment goes from 36 weeks to delivery, and your first appointment is really in depth. They're going to go over family history, medical history, previous pregnancies, surgical history, any medication draw risk factors. They're also going to give you an estimated time due date. They're going to perform vitals. Your blood pressure is really important through pregnancy. They're going to draw some blood. They're going to get your height and weight. They're going to have you pee in a cup. They're going to do pap smear and ultrasound. And depending on how far along you are, the ultrasound will be transvaginal or abdominal ultrasound. After this, your monthly appointments, they're going to do routine appointments. At every appointment, they're going to do your blood pressure. They're going to have you pee in a cup every single time, and they're going to check your weight every single time. Now, for the monthly appointment starting at 10 weeks, they're going to use the fetal Doppler to listen to the baby's heartbeat. They're going to assess the fundal height to make sure the baby's growing appropriately. 20 weeks is when they should do the anatomy scan, the fetal anatomy scan, which typically, that's when you find out the gender of your baby. For 28 to 36 weeks appointment, actually 2-week appointments are going to do the routine things at each appointment. They're also going to encourage the TEP vaccine, and if you're Rh negative, they're going to give you the ROgram injection, 20 units, and they're going to do the glucose test, tolerance 1 hour glucose test. 36 weeks. They're going to deliver the same routine things, and they're also going to assess the position of the baby. They're going to check your cervix. They're going to do the straight swap, and they're going to educate regarding contractions, false labors. They're going to give you warning signs and what it's like if your water breaks. Procedures. The initial ultrasound, they're going to do the 20-week ultrasound. For certain pregnancies require a 3rd or 4th ultrasound depending on the pregnancy. The first trimester would be the UR analysis and the pap smear. Second trimester is the glucose challenge test. Third trimester is the steri swap labs. They're going to draw some blood. They're going to do the CBC, the HCG blood type, the Rh factor test they're going to test for HIV, and 5 genetic tests that you can get done if you choose. 3 of them are blood tests. They'll test your blood. 2 of them test for Down syndrome, and they're called the NIP and quad tests. And the third one is AFP, which tests for neural tube defects. And the last 2, they're considered invasive, but they check for genetic abnormalities. And the tests are called amyloidosis and CBS. Diet is extremely important in pregnancy. It's recommended to increase calories, about 300 more per day for a pregnant woman, although it does depend on pregnancy, weight. Foods, you want to ensure well-rounded diet, eat plenty of vegetables, get potassium, vitamin A, eat plenty of fruit, vitamin C, get enough dairy, calcium is very important, vitamin A, vitamin D, grains, iron, and folic acid is extremely important throughout a pregnancy. You want to eat enough protein through beans, nuts, meats. Just make sure it's fully cooked when you eat it. Make sure your fruits and veggies are washed thoroughly. Drink plenty of water, 8 to 10 glasses per day. And vitamins, you could get a lot of vitamins from your diet. but they also strongly encourage to take prenatal vitamins. Some prenatal vitamins have adequate amount of folic acid, and then some of them you need to take extra vitamins on top to get the full 600 micrograms of folic acid per day, which lowers the chance of neural tube defects for a baby. You also want to take omega-3 fatty acids, which helps with brain development of a baby, iron, because some pregnant women can get very low in iron throughout pregnancy, calcium, and vitamin D. Are important. Make sure your exercises are low impact, which can include walking, yoga, swimming, stretching, Pilates can be low impact, and you want to avoid any contact sports or abdominal exercises, anything like weightlifting. It could make you fall, it could cause you harm or cause the baby harm. Make sure they're all low impact exercises. It's encouraged to do 2.5 hours per week. That can be split up over multiple days. Weight gain during pregnancy is normal, and the optimum weight gain is 25 to 35 pounds throughout the pregnancy. If you're considered underweight, your BMI being less than 18.5, it's recommended to do 28 to 40 pounds. Actually 28 to 40 pounds throughout your pregnancy. And if you're considered normal, BMI is 18 to 24, that's when it's recommended to gain 25 to 35 pounds. And when you're overweight, your BMI being 25 to 29, then it's recommended 15 to 25 pound gain weight. And if you're obese, BMI being 30 plus, then it's recommended 11 to 20 pound gain weight. 3 common complaints during pregnancy. The first one's nausea, vomiting, which are very common. Some things you can do so it doesn't happen often is have a healthy snack with you, have small meals throughout the day. It can be worse on an empty stomach, so small meals throughout the day would help. Also avoiding spicy foods or anything that can upset your stomach. Have ginger tablets on hand. They're known to alleviate nausea and vomiting. Second complaint would be stretch marks. I highly recommend to use lotions. They're pregnancy-approved lotions that are great for stretch marks. You could use with vitamin E oil, all over your breasts, your abdomen, the upper portion of your legs. Use both of these during pregnancy. And the third complaint is constipation. You want to increase your fluid and fiber intake and make sure you get enough exercise. If your physician allows you, you can take some stool softeners. 3 warning signs during pregnancy that are highly recommended to go see your physician or the emergency room is if you experience one of your legs turning red, there's swelling or pain that intensifies in heat in one location, because it could be an indication of DVT, deep vein thrombosis. The second one is if you're experiencing severe and persistent headaches, which could be a sign of preeclampsia. It's extremely high blood pressure during pregnancy and very dangerous. The third one is if you're experiencing severe abdominal pain. It could be a sign of placental abruption, which means when your placenta has come away from your uterus. And that concludes my education. Thank you.